Good afternoon. I'm Robin Steinbach, and we are delighted that you've chosen to join us for the first in a series of town halls with Chancellor Isak and other members of our Riverside Community College District family. This is the first in a series of town halls on our plans for a safe return. And the topic today is facilities and safety. We have prepared a presentation for you, but before we start that, we would like to hear from our Chancellor, Dr. Woldab Isak.
President Steinbach, thank you very much for organizing this. I think it's very important for us to have a forum to exchange ideas and to listen to each other. And as we prepare to return, I think as you will see in the first slide prepared by our capable vice presidents for business services, the safe return principles are ensure the health and safety of students and employees, meet students' need for equitable access to quality instruction and student support services, support instructional needs for the delivery of high quality courses, and ensure resource availability to support all instructions. So in setting the stage for today's town hall, I would like to remind all of us the mission of our district is grounded on principles of social justice designed to create social and economic mobility for our students and the communities that we serve. Our district strategic plan is driven by three major goals, namely access to all who can benefit from our programs, success to help them complete their goals, whether it is for transfer or for employment, and equity to remove all kinds of equity gaps. We are an open access institution to enable for all to benefit from our program, and to do so with minimal or no barriers. It's important to know that about 68% of all our students are California Promise or BOG waiver recipients, which means they are in the socio-economic strata that require senior financial aid need. It's important for us to recognize that the region that we serve, which is the Inland Empire, has one of the lowest college going rates and graduation rates in California. This means we are serving an educationally and economically underserved population. From the spring of 2020 to this semester, our enrollment has been steadily declining. And today we find ourselves at a historic low of 20% below our target. For a fall semester enrollment, this translates to about 9,000 students who have dropped out or failed to return to continue their education. A closer look at who these students are shows that the large majority of them are from among the socioeconomically disadvantaged population, the very ones for whom we are designed to serve. Therefore, it's important to understand that even though that such large decline in our enrollment will clearly have significant decline in our state apportionment and our budget, the more serious and significant concern beyond the budget is the huge decline in access to educational opportunity of a population that we exist to serve. There's a real concern that allowing this trend to decline to continue could place us in a situation that may prove to be very difficult to recover from. Next important fact that we all need to remember is that we are not an online institution. Indeed, the primary mode of instructional delivery that's adopted for our district to fulfill its mission is the face-to-face mode, complemented by a limited of about 20 to 23% of hybrid and online to serve those students who have real needs or real problems to come to our class where education has to go to them to ensure access. And we know from our cumulative past experiences that this mode is neither the preferred nor the most successful mode. We have gone through a very difficult and trying period during the past 13 months, and I recognize with deep gratitude, and I salute the faculty, the classified professional, the administrators, and above all the students for their tenacity, determination, and the heroic commitment that everyone has demonstrated to ensure continuity of instruction and enable the district fulfill its mission. As described earlier, the price paid, however, has not been small. As we access the rapidly changing situation with the light at the end of the tunnel getting brighter and brighter, at the rate at which the rate of vaccination is growing, today we have more than 200 million people already vaccinated in the United States. And the rate of decline in infection rate and in positivity rate, we believe the conditions will be ripe for us to return to the largest extent possible to face-to-face instruction to the same level to that of fall 2019, the pre-pandemic, at which time our total online hybrid offering during the 2019 fall period for Moreno Valley was 21.9%. If you add the online and hybrid, for Norco College, it's about 23.2, and for Riverside, it's 22.5. So it's not different from college to college. It ranges between 20 and 23%. And hence, I know that many of us have viewed the 2080 or the 2080 as an inflexible number. It's a guideline as to what we should take as a baseline. And as you can see, the range is anywhere from 20 to 23. I also know many have asked if we are totally inflexible, will there be accommodation for disabilities, for illness that need accommodation? When we say we are returning back to a baseline, we already in that baseline in 2019, we have the instruments of accommodation in place. Anyone who needs accommodation, either due to disability or illness or other issues, need to go through the process of accommodation, and accommodation would be provided. So we're not creating something that is difficult and that's inflexible, but rather going to a baseline. Now, going to a baseline, make it look for us that we are going to the old norm. And I know that many have also asked, you know, have we not learned anything from this very difficult 13 months? And what about all the capacity and competence and technology that we have mastered in the use of our mission? Are we throwing away everything? No, we are not. And I'd like to assure you that going back to the baseline is important for us so that during the fall semester, we will take very serious look at the data that we have generated, at the successes that we have made, and create a proper system of evaluation from which we will determine what things will be integrated into our long-range plans, into the way we deliver our services, so that our new norm will be defined after a thorough data analysis. I would like to appeal to all of you that, as you will hear from the committee, that safety is a non-compromisable issue. We are not compromising safety. We are not gambling. When we say we are coming back to the norm, we are going to monitor the situation, very regularly and calibrate our ambitions by that development. So if we know, all our assumptions are that the rate at which progress is being made will continue. In fact, we're not too different from what the state is doing. The governor says by June 15 that the whole economy is going to be open. We no longer are going to have the entire system. And we are not planning for June. We're planning for August ending. That's 4 months away from the situation. So we cannot make predictions from today, how we feel about it. Let's look at it very carefully. We'll be communicating with you. As Dr. Steinbach said, we'll have 3 more town halls, and we will have updates every 2 weeks, very carefully calibrating the situation. And if by the end of our assessment that a 2080 is not realistic and we have to have fallback planning, we have asked all our academic deans to also have a plan B and a plan C, where a plan C is where we are today, and a plan B will be in between, so that we will ensure that we will make sure that our return is going to be safe. And I hope that from the capable panel that is in front of you, you will see what serious degrees of preparation are being made. And with that, I'd like to turn over the microphone back to Dr. Steinbach.
Thank you, Chancellor Isak. And we'll have an opportunity to hear from Chancellor Isak near the end of this town hall and with his closing remarks. We chose for our first town hall to focus on facilities and safety, because we know this is first and foremost in your minds, and it's in ours as well. And as Chancellor has indicated, we have been very thoughtful and careful in our planning. And it's my pleasure to turn over the digital stage to the 3 Vice Presidents of Business Services, Dr. Chip West, Dr. Michael Collins, Majd Askar, our Director of District Safety and Risk Management, Bayway 2, and Sergeant Cleveno. There's a presentation that's been prepared. I also would invite you, if you have questions, to enter them into the question Q&A feature or in chat, and we will have a question answer at the conclusion of their presentation. So with that, turn it over to the august panel.
Thank you, President Steinbach. My name is Chip West. I'm the Vice President of Business Services at RCC. We prepared a presentation for you today. There's only about 10 or so slides. Dr. Isak already really covered this first slide, but I want to really emphasize those safe return principles have underpinned and been a foundation for everything that we've done going forward. And so I hope that as we go through our presentation and share information today, that you see that thread running through everything we're doing, especially the health and safety of our students' employees, which has been top priority for us. And it's not intentional that it wasn't put there first on our presentation today. Next slide. We are going forward and we want to share with you kind of our assumptions as we go forward. Obviously, time changes and there's a lot of things in flux and changing as we're moving forward, and we want to share with you some of the priorities. Obviously, as we said before, prioritizing student and employee health is paramount for us. We are looking to provide that equitable access and quality instruction, as well as student support services that meet the needs of our communities. We want to be consistent from institution to institution. So we're really working in tandem with each other to make sure that we're all on the same page and we're all providing a very even approach across the 3 colleges in the district. Our assumption is that we're planning for full return in-person instruction and services. And as Dr. Isak mentioned, yes, there will be fallback plans. Yes, there will be plan Bs and a plan C. But we're assuming at this point that we're going to fully return to in-person instruction. And we know that going forward, if we've learned anything over this last 13 months together, is we have to adapt. And we have to do that quickly and plan for multiple contingencies as we all move forward together in this new post-COVID world. Next slide. Go ahead, Bayway.
Right. As emphasized today and in the past, we take employee and students' health and safety very seriously. To minimize the spread of COVID-19, the district developed a district-specific COVID-19 prevention plan based on the rules, regulations, and guidance published by different government agencies. This regulation includes the OSHA COVID-19 emergency temporary standards and COVID-19 industry guidelines specifically developed for higher education. And we also consider the California Department of Public Health and the county department public health guidance and recommendations when it comes to our program development. Last not the least, the CDC guidelines. Many since COVID is a fluid situation, many of these guidelines got updated constantly. We always strive to adopt the latest version and stay, ahead of game as much as we can. And sometimes this rule and regulation don't completely align by each other. As we can see, they are developed by different agencies. In general, the district adopt the most stringent rules and regulations. Next slide, please. You can access the district COVID-19 prevention plan from the district COVID-19 website. Some of the highlights of this program include hazard identifications and personal protective equipment, the engineering and administrative controls we put in place to maximize the safety factors for our employees and students. We also clearly define how we want to handle the COVID-19 case if somebody have a suspect or confirmed COVID case, and last not the least, how do we manage to return the employee back to district locations? Many of these functions are handled at the district level, and in addition, the campus-specific policy and procedures are developed at the campus level. Today, I would like to talk about some of the functions that are managed by the district risk management department. Next, please. Case management is one of the key roles we play during this pandemic. We would like all employees and students to report their close contact with a COVID-19 positive person, suspect, and confirmed case. For employees, they should report this case to risk management. For students, and they should contact their student health service at their campus. Employees and students are required to either quarantine, isolate if they fall into one of the above situations. For close contact, 14 days quarantine is required. And for suspect case, we strongly recommend the person take a COVID-19 test if they cannot show a negative COVID test. So we will treat it as a positive case. They are required to have 10-day isolation. Similar requirement applies to confirmed COVID case. People cannot just automatically return to a district location when they meet a time requirement. They have to be either cleared by risk management or HR if they are an employee. So for students, the clearance process starts at the student health center at their campus. We use the OSHA emergency temporary standard as our criteria for employee clearance process. Next slide, please. Another important part for case management is testing. We want to, separate sick with well as quick as possible. The district entered agreement with California COVID-19 Task Force and also County Department of Public Health to offer free on-site testing to our employees and students. And currently, we have self-administered COVID-19 tests for employees at risk management. In the fall, we will have similar service to students at each student health center. So they can just, request the test on demand, either for routine tests or tests when they have suspect COVID-19 case. Currently, we also have the county mobile testing van at RCC every Tuesday. So we have different options for our employees and students to take advantage of our capability to do on-site testing. Next, please. Okay. Vaccines are the most effective tools to protect your health and prevent disease. And studies show COVID-19 vaccines are very effective in keeping people from getting COVID-19. In addition, if the person gets COVID-19, if they have been vaccinated, it might help prevent the person getting serious ill, and hospitalization. So, and a vaccine alone will not get people COVID. The district strongly encourage our employees and students to take advantage of the opportunity to receive the vaccine. If you cannot take the vaccine due to existing medical conditions or sincere health, religious belief, you can work with HRER for an interactive process and go through the accommodation process when it comes to employee. And for students, obviously, the Disability Resource Center can assist with accommodation as well. And we enter into a partnership with Albertsons pharmacies and also Riverside Medical Clinic. We currently have on-site vaccination clinic in all 3 campuses. And these on-site vaccine clinics are open to employees and students. Just a couple of weeks, 3 weeks ago, we were able to vaccinate more than 1,400 individuals. Yesterday, we administered 408 shots at Norco College. You can still take advantage of these opportunities this week. We have 2 more clinics coming up. We plan to administer 2,000 shots at Riverside tomorrow at the top level of the parking structure, and Friday there's another opportunities at the Moreno Valley College. So, if you have a chance to stop by, although we strongly recommend everybody make appointment, we also welcome walking. Next.
Great. Hi, everyone. I'm Michael Collins. I'm the Vice President of Business Services at Norco College. I want to talk a little bit about the cleaning and disinfecting protocols. And frankly, our cleaning and disinfecting protocols outlined in our current district safe return plan have proven to be very successful. So these protocols will make up the foundation of our plans for fall as we continue to be ever vigilant in establishing a safe and clean working environment. I just want to take a second quickly to give a shout out to our custodial team members on all of the colleges district-wide. The work that they've done to ensure our learning and working environments are clean, it has been above and beyond. And I just really want to take a second to acknowledge their work and say thanks from the entire district, our students, faculty, our classified professionals. Their attention to detail and diligence really has led to our success so far. In alignment with the current CDC guidelines that were just established for cleaning and disinfecting in April 2021, all products that we use for cleaning and disinfecting are approved for use against COVID, and they're on the Environmental Protection Agency's approved list. So that is one of the guidelines that we follow. Our employees are trained on chemical hazards and product instruction, ventilation requirements, and Cal OSHA requirements, and will continue to be. We utilize target solutions through risk management, of course, but also we train with our vendors, the vendors that provide the equipment and the supplies and chemicals. We train with them, and we have daily meetings with our team members to ensure that we're all on the same page and that they are aware of the requirements of the chemicals that we are using. We are currently performing daily cleaning of the campus environment, and we will continue to move forward in that direction as well, following the CDC guidelines of April 2021. And also, we will ensure thorough cleaning and disinfecting of our commonly used surfaces, high touch areas, and personal work areas. This is important. and we want to make sure that that we have the supplies available for employees to ensure that they can clean their own workspaces and protect their own personal items as well, and keep them clean and sanitized. Next slide. A few of the safety control measures that we will really continue to implement throughout all of the colleges in our district. We're going to continue to utilize physical distancing markers where appropriate and required by regulatory agencies and recommendations. So I'd like to just take a second and remind everyone that these regulations and guidelines continuously are changing. And as I think Dr. West covered it earlier, our plans will continuously change as the guidelines and recommendations change from our, whether it's CDC or the California Department of Public Health. We have to adapt and be ready. We're going to continue to utilize signage and other messaging to our entire campus communities to encourage hygiene standards. And we're going to look for creative ways to do that with our students as well. We're going to continue to utilize touchless hand sanitizer stations containing at least 60% alcohol placed in strategic locations throughout the colleges. We're going to continue to disinfect, provide disinfectant wipes, so they're available for students, faculty, and staff for cleaning and sanitizing shared equipment and individual workspaces and workstations. So we do have on campus, we have on all the campuses, large inventory of wipes and personal protective equipment that has been deployed to this point and will continue to be deployed into the fall, through the summer and into the fall. We'll use face coverings at this point. We believe that that is a realistic expectation as we move into the fall. But we will definitely follow the California Department of Public Health guidance as we move forward and adapt our plans as required and as recommended through the different regulatory agencies. And we're going to continue our ongoing inspection and compliance assessment of our plans and of the work that our entire campus community is doing to follow the plan. And it really, another big shout out goes to our safety personnel, safety and emergency preparedness personnel that are out there, really inspecting the plan, inspecting what we're doing on campus, and then as well as it's a support to our faculty and students. If they have questions, if they need support, they're right there as well. And also it's critical, these continuous assessments do lead to continuous improvement of our plans and has led to that up to this point, and it will continue as we move forward into the fall and beyond. Next slide. Okay.
Okay, my name isNej Daskar. I am the interim vice president of Moreno Valley College, and I'm going to continue with safety control measures that we currently have in place and that we will continue to have in place. So since our COVID closure in March 2020, some of the water systems were shut down, but as we have been phasing back in, we've been testing and cycling the water systems to ensure water quality. And in order to reduce contact when possible, we're replacing common contact points with touchless free options. So the colleges have been investing in installing hand-free devices, such as faucets, towel, soap dispensers, bottle fillers, and hand sanitizers. We are also ensuring that we have a large inventory of PPE and supplies, such as soap, hand sanitizers, disinfected wipes, masks, gloves. And we're making that available throughout the entire building and for students and staff and faculty. You'll see them in classrooms, in offices, in entries of buildings, in common areas. We've also purchased some of the chemical resistant suits for our disinfecting team, who are using disinfectant sprays to disinfect and clean the buildings. In addition, we'll be providing plexi barriers in accordance with current guidelines and as needed. So if the social distancing guidelines are still in place for employees, and 6 feet is not feasible to maintain this 6 feet, we'll be able to provide some type of solid barriers such as plexi. We're also looking at different areas, outdoor areas, and increasing outdoor study spaces by providing shade structures, solar umbrellas and tables with charging stations for phones and laptops. Next slide, please. So the idea is to improve mechanical ventilation to the extent possible. So the amount of outdoor air brought into a mechanical system should be maximized. So to do so, we're opening up air dampers to permit outdoor air. In addition, we're operating the HVAC system continuously throughout the working day. And at a minimum, we're running it 2 hours prior or 1 hour and 1 hour after occupation. We're also committed to upgrading to the highest filtration efficiency when possible and installing MERV 13 filters. And for some of the buildings that aren't capable to handle the MERV 13, we are, like the portables or modulars, we'll be adding portable HEPA filtered systems, air purifiers where appropriate. And now for the next slide, the Q&A.
So we've received a lot of questions and we'll kind of go through those. I think some have been answered, but we'll do our best to try and kind of cover the questions that have come in on the Q&A. Again, a reminder, if you have a question, feel free to type it in the Q&A. I know some people too have put it in the chat, so we're monitoring that as well. And we'll try and get to as many of these questions as we can. Question from Armando about returning to school and social distancing in classes. I believe we've covered this. We've talked about that evolving standards and changes. We anticipate at a full return right now in person that there would not be the social distancing guidelines that we currently have. That's the assumption. But obviously we know that we will need to make changes and we will adhere to any guideline that is required for in-person instruction if that remains. Question about classroom community. If there is a COVID case, so everyone knows that quarantine will be needed. I believe Bayway discussed that, but Bayway, would you like to cover just very briefly again what the process is that folks would be notified in a classroom environment of a positive case?
Yeah, if we have a confirmed positive case in the classroom, typically the process starts at the student health services. They will interview the students and instructors, work closely with the department chairs to figure out the contact for information for each person and do the contact tracing start from there. And we have a dedicated team to do a thorough investigation. Typically within the same day, they send out notification to the students and also notify risk management. Risk management manage the employee part and let them know what they need to do next. A lot of times we also work closely with Dean of Instruction to deploy the continuity plan. So the student will get notified, when they can go back to the class, what's next steps, and also, figure out what's the alternative, the makeup section, all those information typically is pre-planned at the college level.
Thank you, Bayway. We have a question about custodial staff and kind of cleaning.
Hold on, Dr. Chancellor.
Can I just add a little bit to that one?
Sure.
I think it's very important for us to realize that the standards and the process that we are discussing now are adopted. They were the instruments we used when infectivity rates were high. Now, they're not changing, but we also must realize that at the rate at which vaccination is occurring, at the rate at which infection rate and positivity rate are declining, the likelihood of finding students, positive in classroom is going to be reduced by that much. That's one aspect of it. The other aspect that I want to appeal to everyone is for those who are hesitating for taking the vaccine, I want to just let you know that I worked in the industry for 10 years in evaluating medicines. And there is no medicine, no drug that doesn't have adverse effects. And those of you who have relatives who are in the suffering from cancer, taking chemotherapy, you can see that every patient has that side effect, not just one in a few, everyone. But you do the, FDA does the benefit and adverse effect analysis, and then they say that the benefit outweighs the adverse effect they are provided. Now, when we look at these vaccines, not only are they effective at 95%, which is rare. Most of our vaccines are 60 to 65% effective. Not only are they high in terms of effectiveness, but even with the Johnson & Johnson, there were 6.8 million people who were given, and only 6 women showed some unusual blood clotting. And so these are very, very safe medications, and I would really encourage people to take the, because the risk is far greater. Take the vaccination for you and for your fellow colleagues than if you do that. So that's the first. I think that we're going to make vaccination available by the end of June. If everyone cooperates and every one of us are, encouraging, campaigning, informing all our folks to be vaccinated, we will have everyone in RCCD, students, staff, managers, and everyone vaccinated by June ending. We just have to be willing. And, the other thing I want to say is that if we have very few people that are unable or unwilling to be vaccinated, there is an option of, because we have instituted free testing, we will increase the testing so that people will be tested frequently and the infection will be detected. If they do have a positive test, they would not be allowed in the classroom. So every measure would be taken to reduce the risk or chance of having people floating around classrooms with the with the virus in their system. So that's all I want to say. Thank you.
Thank you, Chancellor Isaak. I believe there's some questions. I'm trying to go through them. There's some questions about cleaning, custodial, staffing levels. Dr. Collins, do you want to cover that information?
Sure. Yeah, I'm sorry. With regard to staffing levels, I don't see the question in particular, but with regard to staffing levels and ensuring the ability of our current staff to comprehensively clean the campus and sanitize the learning and working environment once a day. We are assessing that need and assessing our staff, assessing our base needs for those staff members, and we are working towards that so we can understand what the new regulations require us to do, and then how that will impact our personnel and our teams. So we are undertaking that research right now and that assessment currently.
And to add to that, as VP Collins had discussed in our slide prior in safety control measures, there'll be disinfected wipes available for student and faculty and staff to be able to sanitize the shared equipment in individual workstations throughout the day.
Yeah, and just to add on a little bit, we have also through our custodial management team and our custodial teams have really focused in on what equipment and supplies are needed to ensure the safety of our custodial team members, and also to make their work as efficient as possible. ensuring that we can move through and properly disinfect and sanitize our areas on campus, but also doing it in a more efficient and effective manner. So we work with our vendors and receive training, as well as purchase the equipment needed to help support our teams.
Going through questions, sorry. Students, there's a question from an anonymous attendee. If students are required to self-report a positive test, are they required to contact the health center at their respective college? How are these policies and expectations being discussed with students so the process is clear and being followed? Bayway, would you like to cover that one?
Yeah, the student should contact student health center to report a positive case. So we typically will have a nurse or one of the staff of student health center, do the investigation right away to figure out first, is this actually a positive case, because we do have experience some people misread the report, and two, determine what's the impact of this positive case. In addition to the class they report, do they attend other classes? Do we need to notify additional people? So our student health services will do a very thorough job to make sure, every rock's flipped and, cast a wide net to control the situation as soon as possible. When it's time for the students and the class to return to campus, and they need to get a clearance from student health center as well.
Thank you. There's a question from Faith about what resources are being allocated for students with disabilities and how we're ensuring students with medical risk factors are not left behind as we move forward. I'll take the start of that. We're investing significant dollars right now in technology and infrastructure at each of our campuses to really provide resources, expanded software, expanded technology for students. We have received some state and some federal funds that have really infused a lot of resources with us. And so each of the colleges are working to improve systems, both in the classroom, outside of the classroom, student support services and resources to make sure that none of our students are left behind and that we're giving them the support they need to be successful. Anything to add, any panelists?
Chip, may I?
You're the chancellor. You can do as you please. Yes, sir.
Yeah, no, but I mean, I think you said it right. But in the general student population, identifying semi-generalized type of problems, problem of financial, of technology. Now we have special populations with specific needs. And I think the question, as I read it, is that disabled students, depending on the nature of their disability, will need to have something specific that just works for them, that makes sure that access to them is not denied because only standard equipment is provided. So to me, I think that it is an obligation for us. It's an issue of compliance that we need to make the investment that is needed to make sure that all disabled students are provided the kind of support that they need that ensures their participation and their access is guaranteed. So I gave a long-winded answer, but the short answer to it is that, yes, we are obliged by law and we are committed to provide the disabled students the support and the help they need.
Thank you. Thank you, Chancellor Isak. A question from Amanda Vasquez: for spaces that cannot be fitted with the necessary filters, will portable HEPA filters be added? I believe that question was answered. Just for clarification, really the only facilities that can't use the MERV 13 are our portable facilities. So that's where we have standards in place that we're using best practices to make sure that they have supported HEPA filters in those areas. All other buildings, even older buildings like ours at Riverside City College, like the Quad, all have been retrofitted with MERV 13 filters. So even a 100-year-old building can handle those filters.
Dr. West, there's a question here. It says face coverings for both students and faculty within the classroom environment. And I just like to answer that by saying at this point in the planning, the answer would be yes. And I think we would move forward as guidance provides a different approach potentially into the future. But at this point in our planning, we would say yes for the fall, and then work through any further guidance that might come forward. Let's see.
Thank you, Dr. Collins. I believe that was Dr. Oliver Thompson's question you covered there. Through. Sorry, every time I move it up, it slides down when people add more questions.
Dr. West, there's a question here from Frankie Moore asking the question about are we going to clean and disinfect every 4 hours, and is that still the plan? So indeed, that our current district safe return plan and cleaning protocols do call for cleaning every 4 hours. In the new CDC guideline, April 2021 has the guideline states that cleaning once a day is appropriate. So that is currently what we are looking at, and that's what was presented in the presentation a bit earlier. So that would be the game plan for us moving forward is comprehensive cleaning once a day.
I'll mention too that Greg Farrar mentioned to put in the chat good information that any students with disabilities that have concerns about returning should reach out to their respective centers and campuses and staff, that they're absolutely willing and able to support them and work closely with students on a case-by-case basis to ensure kind of self-return. So thank you, Greg, for putting that information in. There's a question about pest control spraying. As there are limited people on college campus, will pest control be spraying prior to return? Main concern is Norco College, fields behind STEM, knock and such, that there might be issues. Dr. Collins, do you want to talk about pest control?
Sure. I want to find the question though. I'm sorry.
At the bottom, 448, anonymous attendee.
Okay. Yeah, darn it. I can't find it. Pest control, as we lead into the fall term after being off campus for so long, is that kind of the question? Yeah. Well, luckily during this, while we've had remote instruction and limited face-to-face, we have had our facilities and maintenance and operations teams and grounds teams on the campus regularly. And part of that regular maintenance that our teams have undertaken is regular pest control. But if there are issues in a specific area, the number one thing to do would be to notify facilities immediately and let us jump on it and make sure that we handle that issue expediently. But rest assured, there has been, and I can speak for Norco College, and I'm sure it's at the other college as well. Our pest control has been pretty active, and it is a regular part of our maintenance on campus.
Absolutely, thank you. There's multiple questions about vaccinations. Are vaccinations required? Vaccination cards, what kind of our process will be about for folks getting vaccinated. Bayway, do you want to talk in general about, you shared a little bit about opportunities for folks to get vaccinated and that we're trying to provide those to each of the campuses. Do you want to talk a little bit about that?
Vaccination is strongly encouraged for the employees and students, and we don't have specific requirements on what kind of proof of vaccination for the employees and students at this time. Like we mentioned many times during this meeting, this is a fluid situation. It could change. And at this time, this is the plan. We want everybody join us to protect you, families and friends. Get the vaccine, do our own part to prevent the spread. If we all do our own part, we will see the end of the tunnel a lot faster.
I'd also like to say that we have many more questions than we have available time, but we are committed to providing you with answers. Chancellor mentioned at the beginning of his talk that we will give regular updates. In fact, there is an update that's published twice a month, and another one will go out next week. And we will also publish this presentation, the recording of this town hall, as well as the PowerPoint presentation and the RCCD COVID webpage. So we will collect your questions and we will see that they are responded to in the updates. There are many questions as well about instruction and support services. And the next topic for a town hall on May 19 will be about instruction and academic support services. So we'll be able to get, we'll use your questions today to anticipate the content for that forum and inform our planning, further planning as well. We do have responses. Are there other questions, Dr. West or Dr. Collins or Madge?
I'm also trying to answer some as I go.
Right. We've got about 48 in there. We're trying to group them. Let's see.
Yeah, I'm trying to answer as I go too, especially if we cover them. So. Bayway, can you talk a little bit? I think there's some self-reporting questions about how, how will we encourage, how will we share with students that they self-report if they are COVID positive? Do you want to talk a little bit about process for that and how we're going to get information out to people and how we're going to track that?
Currently, what we see is a lot of times the student reported to their instructor first. Those are the people they feel most comfortable to share this type of a sensitive personal health information. And we ask our instructors contact student health service right away and also put risk management in the loop. A lot of times we don't just have students in the classroom, we also have employees. We need to manage this process from both ends and get employee and students at the same level of protection, and they can, start to plan the response right away. Typically, when it comes to cleaning and disinfection, it starts with either risk management or student health center contact our facility service, and we typically get really speedy response from them because everybody takes this situation very seriously. And also we have the regulator requirements to notify everybody in the building if somebody positive actually was in the building. So we will send out a notification to all employees, and if there's a contractor in the site, we will send a notification to the contractor as well within the same day. So notification typically is the first part, and we then deal with all the necessary response required by the regulation and also determined necessary by the campus and by the district.
Dr. West, there's a question about will there be COVID-19 vaccination shots in the fall? And in Bayway, I defer to you on this, but I do know that all the colleges are planning regular vaccination events, like weekly and biweekly events through the spring term and most likely into the summer. But Bayway, can you provide a little insight on that?
Yeah, we want to vaccinate as many people as possible. The faster we reach herd immunity, even just at our district, the better off we are out of this pandemic. And we have events pretty much every week, and at this time plan all the way to the summer. And we will see how it goes during summertime, because we don't know how many people will take advantage of the situation. And in the fall, we want to restart the process again. As we all know, if people are on campus, they might be more willing to attend the event because it's so convenient. So make it available, accessible is our goal. And as long as we see the demand, we will continue this effort.
Is there perhaps one last question we want to answer? I see that it's 4:57 and we want to provide our chancellor with an opportunity to make closing remarks. Is there one last question?
Perhaps there's a question, I don't think we have an answer for it, but it's a good question. I appreciate coming from David. Kevin David Arthur asked about international students coming back. So this is something that's a good question, and we'll have to really look at that, at what the requirements are and how we'll work with international students in both communicating our messaging, as well as, if they have documentation, how they'll provide that to the colleges. So it's a good question that, again, we'll work to address these as we go. That's one I wanted to make sure we covered. Any others, colleagues?
There's a question regarding safe distancing in classroom. They're asking about plexi, and again, that's per the Cal OSHA requirements and guidelines. If the 6 feet physical distance is still in place, then those accommodations would be made.
Thank you, Madge.
Chancellor Isak, would you like to provide us with concluding remarks?
Thank you. Yes, I first of all would like to thank the panelists for taking their time and to be thoughtful and sharing all the meticulous preparation that is being made to ensure the highest standard of safety, to be exercised at every college and in the district office. I appreciate that, and please continue with that same dedication. I also would like to thank the more than 230 folks who took time to take part in this town hall. I would like to thank you for your participation, for your questions. We take all those questions very seriously. They're coming both from a desire and a yearning to continue your education, to fulfill your ambitions and goals, but your desire to do it in the most safest way. And our role is to help you do that. We are all having the same goal. As I said, our goal is to create social and economic mobility for all of you so that you can reach your highest ambitions. And I'd like to simply once again state that the safety of our district is in our hands. And we know what makes us safe. We should exercise the highest level of care for each other. Our faculty are dedicated to provide you the highest quality of instruction in a safe manner. Students, staff, and classified and managers, as a team, we should continue to work together so that we can be an example to the entire city and to the community that we serve, that we can carry our business in a very safe manner, even in this difficult time. But everything that is occurring is moving in our favor. And I know that our anxieties are determined by what is today. The guideline that some of you have cited, that under the yellow tire, we should be at 50% capacity. That is today. We're talking about August. And so between now and August, there will be a lot of changes that will be occurring. And so I want you to leave this town hall rest assured that we are very seriously committed to put safety first. We're not going to take risks. We're not going to gamble with safety. Safety is not negotiable. And so let's keep working together. And by the time the second town hall comes, I'm sure that a lot of improvements will have occurred. And our discussion, which will be focusing at responding to many of the class caps and to the courses and to the academic and student services, we will continue to have also a lively discussion and a very productive update. So once again, I thank everyone for making today's town hall a successful event. Thank you.
And I would add that we know that there are many questions that we did not get to. We're committed to providing those responses. We'll do so through the bi-monthly updates that will also be published on our RCCD COVID webpage. Many of the questions that were asked today in the Q&A function, through the Q&A function, also chat had to do with instruction and whether certain courses and disciplines would be available online, or what would be the mix of online versus face-to-face. That is all in preparation now. We'll have more definitive, we'll be able to respond to that when the Vice Presidents of Academic Affairs join Chancellor Isak and the Vice Chancellor of Education Services join him on May 19 at 4 p.m. for the second in the town halls regarding our planning for safe return. We thank you very much for your time, your attention, and your care. And we look forward to being in communication with you. Thank you. Thank you, Chancellor.
Thank you, everybody. Thank you.
Thank you all.
And thanks to Stephen Ashby and the amazing TSS crew from Riverside City College who support these Zoom webinars. Thank you, Stephen.
Yeah,
Thank
thanks,
you all.
Stephen.
Thank you.